kidney stones. Kidney stone disease is also known as nephrolithiasis or urolithiasis. And it occurs when a solid piece of material, a precipitation, a deposit material, it develops inside the kidney or anywhere in the urinary tract. Kidney stones typically form in the kidney and leave the body through the urine stream. A small stone can pass without causing any kind of symptoms, but if a stone grows to more than 5 millimeters or 0.2 inches, it can cause blockage of the ureter, resulting in severe pain in the lower back or abdomen. A stone can also result in blood in the urine because the stone, it wounds the urine, it wounds the glomerulus, it wounds the delicate parts of the kidney, and then it can cause some kind of pain, it can cause some kind of damage inside the kidney. About half of the people who have a kidney stone can develop another one within 10 years. Now, this was yesterday's topic that we are discussing once more, because today we are going to study about the remedy of kidney stones. Types of kidney stones, we have 5 main types of kidney stones. We will just have a brief overview of these kidney stones and then we will go to the main topic. Calcium oxalate stones, calcium phosphate stones, magnesium ammonium phosphate stones, uric acid stones. Uric acid stones are very dangerous stones. They are produced when you already have calcium oxalate stones and then you have a high amount of uric acid in your blood, and then they combine and form uric acid stones, which might be smooth or they might be uneven. Then you have cystine stones. Then we have some stones which are of different shapes. They are staghorn in shape. Staghorn in shape का मतलब ये है कि वो जैसे के horns होते हैं, सींग होते हैं. स्टैग के जैसे हॉर्न्स होते हैं, ब्रांचेस के साथ हॉर्न्स होते हैं. इंस्टेड ऑफ बीइंग राउंड लाइक दिस, दे आर पॉइंटेड. ठीक है, लेट मी ड्रॉ इट ऑन द बोर्ड फॉर यू पीपल. एंड जो है उसमें लेट मी ड्रॉ इट ऑन द बोर्ड फॉर यू. ये यहाँ पर स्टैग हॉर्न जो हॉर्न्स होते हैं, वी हैव समथिंग लाइक दिस, ऐसे, देन लाइक दिस, then like this, they are branched and branched and branched, and इसकी वजह से जैसे कि horns होते हैं इस तरह, these stones they develop in this type of shape. ठीक है, तो next जो है इसमें, let us go back to the presentation now. Okay. These staghorn stones, they kind of जो है, they just fix themselves inside the kidney and then they are unable to be removed from the kidney through urine. Some of the small stones, they can be removed from the kidney via the urine, but staghorn stones, they cannot be removed from the kidney via the urine. So they can cause a lot of damage and a lot of pain to the urine, to the urinary system. Causes of kidney stone: hypercalcemia. Hyper means a large amount. Calcemia, calcium. Hypercalcemia is the condition when we have a high amount of calcium in the blood. Hypercalciuria, when we have a high amount of calcium in the kidney. Hyperoxaluria, when we have a high amount of oxalates in the kidney. Hypercalciuria plus hyperoxaluria are going to give rise to a condition in which the calcium oxalate stones are going to be produced. 70% of kidney stones are due to this condition, hypercalcemia and hypercalciuria and hyperoxaluria. Okay? And the main cause is hyperparathyroidism. We studied this yesterday, that this hormone, it controls the calcium content inside the blood and it is responsible for excretion of calcium into the kidneys. We studied this yesterday. Then hyperuricemia, where we have a high uric acid content in the blood, it causes uric acid stones. About 10% of kidney stones are uric acid stones. 70% of kidney stones are calcium stones, calcium oxalate stones. Then cysteines and phosphates also cause kidney stones. Dehydration, drinking less water is also a cause of kidney stone. Now, this is the topic that we are going to discuss. I got this definition from the internet and I put it here for you people, and let us read it once, then we will go to the board and we will discuss the whole process. Lithotripsy is a medical procedure. It is a kind of an operation involving the physical destruction of hardened muscles. Hardened muscles का मतलब होता है सख्त जो materials बन जाते हैं, like the kidney stones, like the bezoars or the gallstones. These are the different kinds of deposits which are produced inside different parts of the body tube systems due to deposition of calcium, oxalates, uric acid, and different kinds of materials. The term is derived from two Greek words meaning breaking or pulverizing stones and lithotripso. Now, lithotripsy, be very, very attentive now. It is a common method to treat kidney stones. Kidney stones का इलाज इस तरीके से जो है वो होता है, ठीक है? It is a common method to treat kidney stones. We have two types of जो है वो treatment. Now, before writing this, let me go to the board. I will open the new board for you people. You people have to tell me if you like this board or we should stick to the Zoom board. Yeah, okay. Now, what we have over here is we have breaking down of the kidney stones. Okay, we have breaking down of the kidney stones, and this is done by two main methods. Done by two main methods. And what are these two main methods? These two main methods are actually, before telling you the names, one is that you apply shocks just externally. And one is that we insert a tube into the kidney and then we apply the shock waves. These procedures, we choose a procedure depending upon the size of the kidney stone. Depending upon the size of the stone, we choose the procedure. We have two main procedures. One is totally external. We just apply shock from externally and then the kidney stone is broken down and then it is passed out via the urine. Then another one is that we have a larger kidney stone, because I have said that the size of the kidney stone depends on this. We have a larger kidney stone. In that situation, we have to insert a tube and then we have to apply shock waves and then we have to manually get the stones out. In the olden times, in the old fashioned जो तरीका था, उसमें ये था कि उसमें ऑपरेट किया जाता था, टिश्यूज को कट करके बॉडी को ओपन किया जाता था एंड देन किडनी स्टोन जो है वो उसमें से निकाला जाता है. बट दिस इज अ बेटर, अ कंफर्टेबल मेथड इन व्हिच वी डू नॉट जो है हैव टू ओपन द बॉडी ऑफ द पेशेंट टू अ वेरी लार्ज एक्सटेंट. ठीक है, ओके, लेट अस गो बैक टू द है और देन लेट मी कम बैक. Okay. Lithotripsy. Lithotripsy is a common method of treatment of what? Of treatment of kidney stones. Lithotripsy is a method, a common method of treatment of kidney stones. ठीक है, तो इसके ऊपर शॉर्ट क्वेश्चन आता है और इसके ऊपर शॉर्ट क्वेश्चन क्या आता है वो भी मैं आपको बताती हूँ. ESWL, ये जो एब्रिवेशंस हैं, these two abbreviations, ESWL, ESWL, ESWL and PCNL, these are two abbreviations that can come for you in the MCQ exam. ESWL is known as extracorporeal shock wave lithotripsy. Extracorporeal, extra means outside. Extra means outside. And corporal means we apply the pressure. We apply the pressure. We hit something continuously. We keep on hitting something. कहते हैं ना corporal punishment. Corporal punishment जब बच्चों को मार पड़ती है. Corporal punishment. Extra corporal from outside. We hit the stone with shock waves. ठीक है. Extra corporal shock wave lithotripsy. Extra corporal shock wave lithotripsy. And the machine that we use is the lithotripter. It generates shock waves. It targets the stone. Now, how do we see the position of the stone? We see the position of the stone through an ultrasound machine. And then we mark the position, and then it breaks the stone into very small fragments, and these small fragments, they pass out through the urethra. क्या है ये ESWL, extra corporal shock wave lithotripsy, बाहर से जोर लगाना. Then PCNL, percutaneous. Cutaneous, now you can keep it in mind that cutaneous means something related to the skin. Percutaneous nephro, skin and nephrons. Lithotripsy means skin and nephron. We are going to connect the skin and the nephron. There is something that is going to be connected between the skin and the nephron. इसको ऐसे याद करना है. PCNL, percutaneous nephrolithotripsy. In this situation, a tube is inserted. Now, what is happening? The person is going to lie on the stomach. मतलब ये है कि वो पेट के बल लेटेगा. And then the kidney position, I already told you people the position of the kidney, that is between the thoracic and the third lumbar vertebra. The person is going to lie on the abdomen, and then what is going to happen? The position of the kidney is going to be seen, the position of the stone is going to be seen, and then a tube is going to be inserted. And that tube is going to be inserted through the skin into the kidney to the position where the stone is. In this tube, this is a case where we have very large stones present in the kidney, or we have staghorn stones present in the kidney, and a tract is created. Tract का मतलब होता है रास्ता. ठीक है? A tract is created. A scope is inserted. Scope का मतलब है camera. This is a special type of very small size camera. The camera is inserted, and through the camera, we will view the stone. Through the camera, we will view the stone, we will break up the stone, and then fragments are grasped mechanically, and they are taken out of the tract. Open surgery nowadays is obsolete. Obsolete means it is out of fashion. Now, let us go back to the board. Let me use this board, then people will tell me how the board is. If you like the board, then we will continue this board also. Let me give you the question. Let me give you the questions that you can extract. First of all, you can you have to write down these questions. Compare the modern methods used for kidney stone removal. ये क्वेश्चन भी आ सकता है आप लोगों का ये क्वेश्चन भी आ सकता है. नेक्स्ट वन, व्हाट डज, कैन यू सी द बोर्ड? Can you see the board? Can you see the Microsoft board that I'm using, that I'm writing the questions on? I don't know if you can see the board. Can you see the board? Okay. Thank you. Okay, what does ESWL? What does ESWL and PCNL stand for? ये क्वेश्चन भी हो सकता है. ठीक है, फिर उसके बाद what are the functions of the following in kidney stone remedies. एग्जाम्पल यहाँ पर स्कोप, अल्ट्रासाउंड मशीन, ट्यूब, ठीक है। तो ये छोटे छोटे क्वेश्चंस हैं जो कि आप लोगों को जो है एक्सपेक्ट करने चाहिए। ओके बेटा, लेट अस गो बैक टू द प्रेजेंटेशन नाउ। Now, this was about the kidney stone removal, and the next topic that we are going to discuss is kidney failure. Kidney failure is the next topic that we're going to study. Kidney failure is actually defined as a decline in kidney function. Decline means fall. It is also known as renal failure. Chronic kidney failure means that a kidney failure that is for a very long time. When we say that a disease is chronic, it means that the disease has been with you for a very long time. When we say that the disease is acute, then it means that the disease has not been with you for a very long time. It has been corrected. It has been, the remedy has been taken for that disease. So chronic kidney diseases can lead to chronic kidney failures, and chronic kidney failure is actually an irreversible condition, and it is a gradual deterioration which takes place over the years, and finally the whole kidney gets useless, and it stops to function in any respect. ठीक है, तो chronic kidney failures जो हैं, this is a very dangerous situation in which your kidney जो है, it becomes useless, it stops to work. Now the causes of kidney failure are many. Sometimes it can be because of an accident, sometimes it can be because of a shock, sometimes it can be because of blood sugar, diabetes mellitus. Sometimes it can be because of a very high blood pressure, because we know that the pressure in the glomerulus is already high, and when we have a very high blood pressure in the kidney, then there are chances that the glomerular capillaries might burst. Then this leads to the malfunctioning of the kidney. It can be due to some dangerous diseases, some bacterial infections. It can be due to nephritis. Nephritis means kidney infection. It can be due to inflammation of the glomeruli. What I have not written over here, you can please write it down. Due to inflammation of the glomeruli, due to nephritis, that is infection of the nephrons. It can be due to severe bacterial infections. It can be due to high blood pressure. It can be due to diabetes mellitus. Whatever the reason, kidney failure is fatal. Why is kidney failure fatal? Why is kidney failure fatal? Who is going to answer the question? Why is kidney failure fatal for us? Yes, somebody, anybody. Welcome to the class, Hasnan. Anybody, why is kidney failure fatal? Can anybody give me a correct answer of kidney failure being fatal? Let me open the whiteboard and again, let me see the answer that you have given me. Kamran Adil is saying kidney is unable to filter blood. Okay. Any other answer? Any other answer? We have already studied the whole topic. Any other answer? Okay, toxic substances are accumulated in the blood. Very good, Kamran Adil. Shabash. Any other answer? Can anybody add on to this answer? Anybody else? Why is kidney failure fatal? Question क्या है? Kidney failure is fatal. Why is kidney failure fatal? Now, when we see the process of excretion, we saw that water content is controlled by the kidneys. Okay? Sodium ion contents are controlled by the kidneys. Chloride ions are controlled by the kidneys. Then divalent ions like calcium and magnesium, they are controlled by the kidneys. Then proteins and glucoses and all these things, they are absorbed back. Proteins and useful material, let me just write it like that useful materials, you can make up a very good answer for yourself. Useful materials are absorbed back into the kidneys. ठीक है, and that means कि wastage of useful materials जो है उसको control किया जा रहा है. Then उसके बाद nitrogen waste जो है they are removed from the kidneys. Nitrogen waste जो है इनको kidney में से निकाला जा रहा है. Now once you are facing a kidney failure, once you are Sayyid Haider Maruf is saying the failure of the kidney will lead to excess amount of electrolytes in urea. Yes, shabash, very good answer. Excess amount of electrolytes and urea. This was what I was trying to tell you people, that all these things are controlled by the kidney because of aldosterone, because of parathyroid hormone, because of antidiuretic hormone. And then in the kidney, when we see the kidney, let me take you back to the slide. When we see the kidney is made up of different parts. It is made up of different structures, and each part of the kidney is carrying out a specific function. Let us have a look at the kidney. Each part of the kidney is carrying out a specific function. Look here. Kidney failure means failure of any of these parts. That means water control can also become a problem. Bicarbonates and electrolytes can also become a problem. Here, glomerular pressure filtration can also become a problem. When if the glomerular filtration जो है वो यहाँ पर नहीं हो रही है सही तरीके से, that can also become a problem. Control of the water content can also become a problem. These are different kinds of problems which if we do not allow, we do not control, they can lead to a very chronic condition which is known as kidney failure. Now all these things, they are controlled by the hormones that we have. ठीक है, तो इसमें ये है कि किडनी फेलियर की वजह से क्या होता है कि ये वाले मसाइल जो हैं, these problems जो हैं, ये arise and they cause a lot of difficulty for the patient. In this condition, all these electrolytes, they start to accumulate inside the blood, and then the patients जो हैं, they have a high urea content inside the blood. High urea content inside the blood is known as uremia. Or we can say generally, high toxins concentration inside the blood is known as uremia. This uremia means that we will observe in such a patient, we can observe swelling on the face of that patient, eyes will be swollen up, the hands will be swollen up, the skin will become kind of abnormal looking. The color and the complexion will become pale due to the accumulation of toxins. That is known as uremia. And if we do not control the kidney failure, because kidney failure, it does not occur suddenly. It takes some time, slowly it advances, and then it becomes the end stage renal disease. ठीक है, end stage renal disease. MCQ question है, लिख लीजिए सारे लोग, ESRD, end stage renal disease. आखिरी स्टेज किडनी फेलियर का इज एंड स्टेज रेनल डिजीज. जिसके बाद क्या है, जिसके बाद यू नीड अ किडनी ट्रांसप्लांट. वी विल स्टडी अबाउट किडनी ट्रांसप्लांट इन द नेक्स्ट क्लास. यू नीड अ रेगुलर डायलिसिस. We will study about dialysis, comparison of dialysis in the next class also. Don't miss the class tomorrow. Okay? You need a kidney transplant and you need a regular dialysis in case of end stage renal disease, ESRD. You people, if you do not take care, if we do not drink a lot of water, if our kidney is damaged due to an accident or due to a disease or due to any other high blood pressure condition or diabetes condition, then it can be very, very dangerous. Then we have another condition, which is the acute renal failure. Acute. When we say that a disease is acute, what does it mean? When we say that a disease is acute, then what does it mean? Acute renal failure, acute. एक तो हो गया ना chronic, जिसमें कि आखिरी स्टेज थी. वहाज, how are you बेटा? जो chronic disease होती है, जिसमें कि आखिरी स्टेज है. अब है acute. What is the meaning of acute? Acute का मतलब होता है कि ये एक डिजीज है जिसको हम क्योर कर सकते हैं. इट कैन बी बिकॉज ऑफ एनी रीजन. हम इसको क्योर कर सकते हैं. कभी कभार ऐसा होता है कि आपकी किडनी के अंदर प्रोटीन अमाउंट अमाइनो एसिड ज्यादा हो जाता है. ठीक है. These are also minor forms of kidney failure. Yes, I have got an answer. Let me see who is answering the question. Can be cured in a short time. It is a short-term disease. Yes, beta. It is a short-term disease and it can be cured. Sometimes we see amino acids in the urine. We can detect glucose in the urine. We have high urea content in the urine. Then due to kidney pain, due to kidney infection, vomiting हो जाती है, diarrhea हो जाता है, urine बहुत ज़्यादा pass होता है, a large amount of urine is passed, क्योंकि maybe because ADH जो है, it has stopped working for some time. ठीक है. Then due to this problem in the kidney, due to the pain in the kidney, we start to sweat a lot, and then obstruction in the kidney can be a cause of acute renal failure. Okay, so the acute renal failure, it can be cured very much, and it is because of maybe kidney stones. It can be because of malfunctioning of the hormone for a short period of time because of any kind of disease. Okay, malfunctioning of hormone. It can be because of any other medical situation, like women that are expecting, they face many problems also. Okay, so they face many problems. Sometimes blood is seen in the urine. Sometimes proteins and amino acids are observed in the urine. Sometimes albumin is observed in the urine. So these are some conditions which can be cured. This is a temporary failure of the kidney. This is known as acute disease, and it can be rectified by medicines. It can be rectified by medicines. Okay, so this was all about kidney failure. The questions that you should expect in this situation are, for example, let me write the questions here for you. Define kidney failure. Define kidney failure. Okay, what is meant by uremia, diuresis. Diuresis means beta passing out a lot of urine, excessive excretion of urine. That's called diuresis. Uremia means accumulation of toxins, a lot of toxins inside the blood. ESRD, end stage जो है renal जो है वो disease. अब ये तीन एक नंबर की डेफिनेशन है जो कि फिर आप लोगों से जो है उसमें पूछा जा सकता है. ठीक है, यहाँ पर इसमें ये क्वेश्चन हमारे पास आ सकता है. फिर उसके बाद जो उससे पहले हमने लिथोट्रिप्सी वाला जो पढ़ा हुआ है, कंपेयर, आई थिंक आई गेव यू द क्वेश्चंस, द मेथड्स used for kidney stone remedy. Okay. This is all for the class today. In the next class, we will be discussing dialysis. Dialysis is a very, very important topic. You should expect short questions in dialysis. This time we did not have short question in dialysis. You should expect short question in dialysis, the types of dialysis, hemodialysis and peritoneal dialysis. Okay, I'm going to go back to the main slide. If you have any questions, just ask me and then let me just close the class. If you have any questions, तो आप मुझसे पूछ सकते हैं बेटा. जी, any questions? Any questions? Yes, do we have questions?